Hello my favorite people, today we're going to be reacting to the UK healthcare system and compare it to the US healthcare system. Now there's no denying that y'all's version of healthcare is way better than ours. It's free, it's accessible, everybody can use it. I don't know if foreigners are able to use it, but I would assume so because it's like universal. That's stuff we're going to find out from this video. The reason I'm even interested in the UK healthcare system is, as some of you know, I'm going into nursing school this upcoming fall, and I plan to do travel nursing, and the UK or England is somewhere on my list that I would want to travel to and work as a nurse. But before that can happen, bitch, I need to know the basics of what goes on over there, how the systems run, all the rules and all that stuff, so I can be prepared. Side note, I'm still recovering from a cold or allergy attack. I don't really know what's going on. My voice is messed up, my nose is stuffed, it's a mess. But I still wanted to get content out for you guys, and I actually enjoy doing this, so we can work through the mess. Anyways, if you're new here, make sure you subscribe, like the video, DM me video requests over on Instagram, and I hope you guys are liking the new culture channel, because I'm really enjoying it. Enough talking, let's get into the video. I want to learn about the nurses, the doctors, medication, NHS, the process of becoming a patient, all that. Let's see. Like the video.
Healthcare systems cannot be more different when we compare the United States and the United Kingdom.
Yeah.
The United States has the largest private sector system, while the United Kingdom has one of the largest public sector systems.
Private versus public, basically just money differences. I was talking to my friend actually yesterday about how a lot of the things that we've done during the pandemonia, I can't say the word on YouTube, but have kind of been to help the people. Like we just started a new program where we don't have to pay for internet anymore, like the government is funding that. It's all like about relief. And I was like, okay, but how does that still help, or how is that going to help people who do come down with the situation and go to the hospital and can't afford care, or you know what I mean? So he was like, I said, is that ever going to change? And he was like, probably not, because to get universal health care, that would completely annihilate an entire industry of pharmaceuticals, corporations, a billion-dollar industry, and we are a capitalistic country. So money is basically what keeps us forward. So a public or universal healthcare system would not work in America, which is really sad because it's a beautiful thing. Like, y'all are actually so lucky to have free healthcare. I'm actually jealous. Like, what the?
Both systems are highly respected and
Yeah.
have world-class health outcomes. But the UK healthcare, otherwise known as the National Health Services, NHS, has way fewer health outcomes variation across its population when compared to the US.
National healthcare system. I thought the NHS was just like what y'all call your nurses, but it's your entire healthcare system. Okay, learn something new. Cool.
If you want to discover the main differences between both systems, make sure that you stick around to the end of this video. Healthcare in the US is almost exclusive by private sector providers.
Yeah.
Hospitals are owned by either for-profit or non-profit organizations. Most of the people in the US have access to healthcare through a blend of private health insurance, Medicare, and Medicaid programs. Medicare is
But
a
private
program
freaking insurance is hella expensive. I got it through my employer, but it was still like $100 out of my paycheck, and my paycheck wasn't even that big before. This is when I worked at a nursing home, basically. And then to get Medicare and Medicaid, it's so like not barely anybody qualifies. It's just like moms with a bunch of kids, or no college student qualifies, me. So Medicaid, Medicare doesn't really help me. Like, where do I fit in to society? All I can really do is pay for insurance, which is really expensive.
Medicare is a federal program that provides health coverage if you are 65 years or older,
Yeah.
no matter what income you have. Medicare also provides coverage for people with disabilities, even if they are under 65 years old. Medicaid, on the other hand, is a state and federal program that provides health coverage if you have a very low income and cannot cover your healthcare costs by yourself.
That's not true, because bitch, I applied and I got denied.
The remaining people who are not covered by private insurance, Medicare, or Medicaid will have to rely on their own financial resources to cover their health and medicine expenses. The United Kingdom healthcare system, otherwise known as the National Health Services, NHS, is an ideal example of socialized medicine and a single-payer healthcare system.
And socialism does not automatically mean a bad thing. I learned that through these reactions. Because over here you hear the word socialist, socialism, it's like, no, no, no! But what could be so bad about helping everybody, you know? like a universal healthcare system. If that's socialism, then it sounds pretty good to me.
This means that healthcare is provided by a single payer, which is the British government, and it's funded by taxpayers of the United Kingdom.
Okay. So, y'all get free healthcare by paying taxes. I would be fine with that, honestly, because my taxes are just, for the last 4 years, paid for Trump to go golf. I'd much rather my taxes go to universal healthcare for everybody here, or some program that's going to benefit all the people, than a bunch of nonsense. Like, our taxes are being thrown around all over the place. They might as well go towards something, like, we're going to lose that money anyway, so it might as well go to something that will return back and help the people, you know? I'd be fine with paying some taxes, just like y'all's education system. I'd be completely fine paying taxes for free education for everyone. Like, that's still in a way free to me, because that money's going to be taken out with some tax regardless.
The appointments and treatments are provided for free to patients, as are most of the prescription drugs.
What? Y'all get free prescription drugs? I thought it was just the service and care. Like, you go into waiting room, sign on, get on the list, the waiting list, and a doctor will see you for free. But you get free medication as well? That's not going to happen. Pharmaceutical companies, bitch, over here, they want their coin. They demand their coin. And if you don't give it to them, they'll take your assets. Wow. Luxurious lifestyle in the UK. What a life. What a life. Whenever I tore my ACL, luckily it was covered by my school's coverage because I tore it at practice. But if I had torn it just walking up my stairs or something, to this day I would probably still not have an ACL or had the surgery to have it repaired because, man, debt. I don't want that looming over my head. I already got some student loan debt. I don't need medical debt. Ugh, man. Y'all seriously appreciate the NHS, please, because it's not a luxury people can even comprehend. Like,
well, let's re-emphasize that it's paid by taxes, so it's not truly free.
That's still free.
But the NHS is not entirely free. There are some services that require patients to pay, such as dental and eye care. But the fees are comparably low to the US fees. The maximum cost of receiving any drug prescribed by the NHS is $12. The United Kingdom does allow employers to offer private health insurance plans to workers. Some of these workers decide to opt out of the NHS and receive their medical treatments privately.
Why, though? Just a question. Is it better care to go private? Would you receive, like, less wait time, better doctors? Though what's considered a better doctor? Like, why would you rather pay for a private than just get it through the government for free? You know? If you do get private insurance or healthcare, let me know in the comments down below. I would just rather save your money, you know?
It is quite an advantage as private patients choose their specialists, unlike NHS patients. Private patients also avoid waiting lists for non-emergency procedures, while NHS patients tend to wait for weeks or even months. You gotta wait for months to get care. Yeah, that would make sense, because if it's free, everybody's just going in for paper cuts and blowing their nose and stuff. They claim everything's an emergency, but, you know, someone's over here with their arm amputated. So there's a long wait time, I guess. When it comes to accessibility, NHS patients receive their primary care from general practitioners, which are referred to as GPs, who act as gatekeepers for secondary care. Yeah. So I think what he was saying there is you're not going to always see the doctor. Like, sometimes you might see the PT or their assistant or nurse, who are all just as capable as seeing a doctor, but that's cool. That's even more, like, jobs available for people. When it comes to accessibility based on age, the National Institute for Health and Care Excellence, otherwise known as NICE, consults Citizens Council to help it sort through difficult ethical issues such as prioritization of patients based on age, which is simply not allowed in the UK. Patients are... But yeah, if I'm in line to seek help at the doctor's, I'd rather have a 90-year-old go before me. I can wait a little bit. All age should receive the same degree of access to the healthcare system. Now let's compare the US and UK healthcare system. The United States spends more on healthcare than any other country. When compared to the United Kingdom, the expenditures of the US healthcare system are approximately double the expenditures of healthcare system in the UK. It is worth mentioning that the United Kingdom's NHS services have a low cost when compared to other developed nations, according to the World Health Organization. UK spends around $4,000 per person, while the US spends $10,500 per person. That means that the United Kingdom spends around 9.8% of its GDP on healthcare, while the US spends 16.9%. That's a huge difference.
Yeah.
But wait, there is always a trade-off.
How much do we spend on our military? I know it's like 600 million or 600 billion or something.
For a low cost. The NHS is known for slow responsiveness time. When compared to the US healthcare system, which ranks as number 1 for responsiveness, according to the World Health Organization.
So we see people way quicker than y'all. But of course, because we're paying thousands of dollars for the care. I better see someone quick.
The US healthcare system is responsible for population's wants and needs. The UK healthcare is financially constrained, which would result in wants to be constrained. This is seen in the form of a long waiting list for non-essential medical care, which is required by people in the UK, and obviously this is met by long waiting times.
But who decides, okay, you're not as important, wait in line. Oh, you're not as important, I'll see you next week. Like, if I'm having an issue, I want to be seen right then and there. Even if, like, someone else says, I broke my nose, okay, but there's someone having a heart attack. My nose is still broken. Like, obviously it's not as dire as someone literally having a heart attack, but I need to be seen just as much. Like, I don't know. The waiting time is kind of iffy. Ugh.
NHS patients wait an average of about 8 weeks for treatments that require admission to a hospital, 4 weeks for outpatient treatments, and 2 weeks for diagnostic tests.
That's
when
a lot,
it comes to life
though, to
expectancy and infant mortality, the UK has a better ranking than the US.
Yeah.
UK citizens have a longer life expectancy and lower infant mortality.
I saw like a statistic that in America, black women are way more likely to like die in childbirth or have complications. Just a note if anyone wants to research that. Thought it was interesting.
In 2017, life expectancy in the UK was 2.7 years higher than in the US.
Whoa.
And the infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births.
And isn't that funny? Because y'all stereotype is like you don't shower, you don't brush your teeth, your hygiene is horrible. But bitch, your life expectancy is higher than ours.
As opposed to 5.8 in the United States. The UK has a more acute care hospital beds per capita and fewer deaths related to surgical or medical mishaps. So you can clearly see how both healthcare systems are different from each other.
Yeah.
They both have pros and cons since they follow completely different philosophies. Tell us what you think about these different healthcare systems in the comments section.
Alright. Honestly, I would still rather prefer the UK one. Because again, even with a long wait time, at least I'm not going into debt over a sore tooth. And I'd walk in knowing I'm going to get care and not walk out with a huge bill. And even still, if I had insurance, I would still be paying a deductible. Like when I went to get my wisdom teeth taken out, I had insurance through my employer. But I still had to pay like $1,000 and the employer paid $1,000 and then I still had to pay $1,500. So it was just like, I don't know. I prefer the UK healthcare system. Give me your thoughts in the comment section. Like the video. Subscribe if you're new here. What other content do y'all want to see on the channel? I'm down to do it all. So leave some comments and suggestions. Bye.